This is the ZMAR Podcast. Elite Benefits of America helps small and mid-sized companies with their health insurance programs. And now, your host, Butch ZMAR.
A lot of people that know me personally know I'm a big book reader. One of the current books is about World War II and the fight with the Japanese. And one of these veterans that were in this book, and it talks about a bunch of them that were quasi war heroes, and so I don't remember specifically which one it was, but he talked about having a bad eye, and then when the draft was occurring, he figured he'd just raise his hand and go, and he went to the Navy, and when he had his bad right eye and they caught on it during the exam, they kicked him out, and he failed the Navy medical exam. So before records could be transferred or acknowledged, he went over to the Marines and said, "Hey, I want to do this." Well, he figured out how to adapt to his one eye, and so he was able to pass the medical exam. And then for the shooting, he kind of just adapted, but he kind of just goes along. And at one point, while he was in combat, there was a new rifle that showed up, and somehow I don't know the difference of the World War II firearms, but I guess he was able to shoot from left instead of right, which he was lefty anyways, and he had a stronger left eye, and he was able to shoot better and get better results. And so when I was reading this, obviously because of what we do for benefit programs, it made me think about a lot of things that we've done over the years, not only just us as an agency, but historically for people and employers that are purchasing health insurance. We always we have this bad eye, and we keep shooting one way, and we wonder why we're not getting the results that we really want and desire out of it, but we kind of figure out as we move along, which is basically what this guy was doing until he figured out that there was this new firearm that he could shoot on his left side and able to shoot better. And a lot of that is with how we build health plans in the workplace and how we deal with the insurance companies and the vendors. And once you find out that there's basically a new weapon that you could use, you start providing better access, lower costs. You start beating the healthcare curve. You start reversing it. You start having a lot of control. And so the problem is people are still shooting with the bad eye, and they still can't figure out a better way to do it. There was a recent study that came out of a group that did a survey through Forrester about healthcare company and customer service, right? And it came out that they're bad and they have been for decades. And so they rank healthcare or health insurance companies 15 out of 19 surveyed. And so they were near the bottom of the list of how bad customer service really is. As an industry, it's just terrible, right? And the service model that they have has not gotten better at all for over the years. And even when it comes down to patient level, there were surveys that were done through all this that 40% of the patients that were surveyed avoid healthcare, mainly preventative care, just to avoid the billing aspect of it because it's so horrendous and it never improves and never gets better. And it's just crazy how that the customer service on all these insurance companies. And the interesting part about this Forrester study, they name carrier insurance companies that you use on a regular basis, big name, branded, billboard, commercial carriers. And I'm not going to mention them, but we all know them, right? And what's interesting is they sit in a room, right? So a lot of them are driven based on some type of stock price, either internal or external. And they sit in a boardroom and says, okay, how do we protect the shareholders and still pay claims, right? They have to make a calculated business decision on whether or not they're going to improve their customer service outcome, right? So they purposely say, we're going to sit in a room and they're not going to increase customer service and just deal with it because it has zero ROI attached to it. So they have no incentive to actually make it better because the reality is they still get business no matter what. So like even when you look at the insurance company standpoint, right? You still need insurance, and they do a lot of marketing, and eventually you'll always be there, and they'll always have customers because the big ones capture majority of the marketplace to begin with, right? And the proof in the pudding for this is their stock prices. My understanding from when I was reading this, that even just as of recently in 2023, that their stock prices are the highest than ever. Now, there's some nonprofits out there that don't have publicly traded stock company, but they're profiting more and more as a nonprofit, if you want to call it that. But also in the healthcare system, the hospital and the providers, they have bad incentive to improve outcomes because they know that you're going to avoid certain services, such as preventive care, that could actually reduce the cost of healthcare in general. But because they know you're not going to do anything until it gets bad enough, and you're going to come back to them anyways. So they're going to get the business, and it's going to be more expensive. So they're better off trying to bill you for expenses when it gets more expensive than worry about whether or not you come in early enough and detect it early enough where the costs are lower. So it's a financial decision that they make. But if you look at other industries, right? So we got shoe companies like Zappos, and then you got Nordstrom and the Ritz Hotel, right? They have direct impact to the bottom line based on how they treat people and the customer service, right? In healthcare, there is no incentive. It's not designed that way. And the reality is what it comes down to is no one's taking responsibility for the problem. They defer it. They push it to somebody else and claim it's somebody else. How many times have you called the provider and said, hey, something's wrong with this bill. I don't know what it is yet. They say, oh, yeah, it's the insurance company's fault. Call them. You call the insurance company says the provider billed it wrong, or they filed it wrong, or they didn't do what they were supposed to. So who's at fault here, right? Like, you're stuck in the middle of it all. So, and I mentioned this claim before. So even on a personal basis, we had a claim from a hospital for my son, and they tried billing me $13,000 and some change. So I call them and says, hey, this is inaccurate. I have health insurance. They said, call your insurance company. That's what they told us. And well, the reality is they had it wrong, not only once, but they had it wrong twice. And the second time was 1 year after the claim. They reconciled again, and it was because of misfilings by the hospital. So it's just kind of interesting where the billings that come through and who's responsible for it and who's going to fix the claim. There are times the insurance company processes it wrong too, and that's okay too, but you have to obviously call them and get them to own up to it and fix the problem. And even in my own personal claims, we've had a ton. So anybody listening to this that knows me personally, my boys are going through a bunch of stuff here and there, just boys will be boys. And 90% of the claims that we have received so far in the last 2 years have been inaccurate. If that tells you how inaccurate the whole billing system is. There's been a flaw somewhere in it 90% of the time. And you can't take it for face value. Just because you get an invoice from a provider doesn't mean that it's going to be accurate. Like, here's another prime example. I just recently got one of the bills. They're actually charging me more than what the explanation of benefits said. So when I called them, they just said, oops, sorry about that. But they sent me an invoice trying to get me to pay for it. And so just errors all over the place, and you just have to put a little skin in the game. Some people throw their hands up and say, I don't understand this. I don't have time for this. Well, you know what? You don't have time to not deal with it. And then that's the issue, right? You have to put skin in the game and figure it out. It does take some time. You just have to put it in, just like everything else. You make decisions and you make priorities that fit your needs. Well, has to be fit in your name. You don't need to go to Starbucks. You could avoid that visit and figure this out because it probably won't take you 10, 15 minutes. So some say the healthcare system is broken, but the reality is it's working exactly the way it was designed. Healthcare has money in mind only, not outcomes, right? Sure, you might have some people have really good bedside manner, and they probably really, really do care about their patients. But I'm just saying everything's about a dollar. And if the dollar isn't high enough, you're gone. The physician's not sticking around. And so it's all about the almighty dollar when it comes to healthcare. And they don't really care about you as much as far as claim payments and what you owe, because they're heartless about it, actually. And so the true customer is actually the insurance company, because they're the one with the bigger purse and they could care less about what claims are. Whereas you're going to say, whoa, hold on. Why are you billing me $400? They don't want to deal with that. They don't even want to deal with the $4,000 bill that you complain about. They just want it paid. They don't care. They're going to charge what they need, and that's it. And it's crazy the amount of services, what they bill for. They can make up almost any number. We had an employer account recently. We get an expense report for it, which most plans don't. But and I recommend any employer listen to this, that they should move to a plan that provides an expense report. And so they had an expense report that the original billed amount to the insurance company was in the hundreds of thousands of dollars. And the amount paid or allotted for claims was in the 30,000s. So they come up with this huge number that doesn't make any sense, and it gets reduced down to what payable is. Even pharmacies do this, and there's a very, very, very large pharmacy that I'm not going to mention their name, but I despise them in a lot of ways, mainly because if you, let's say you went there for a prescription drug and you never gone to them for a prescription drug. Somehow they have access to this database. Don't ask me details on that because I don't know how they get access to it, but they got a database to verify if you have insurance. And it'll populate and say, oh, you have, so-and-so insurance company. And you ask them, well, I was thinking about paying cash. What's the cash price? Well, they're going to say, well, you have insurance. We cannot give you the cash price. And there's no law that says that. It's proof in the pudding that the insurance company is their customer, not you. And the insurance company is overpaying for most of the drugs. They pad them and they get rebates on it. And they've been sued for it, and some won, some lost. And it's getting crazier and crazier. And some of those pharmaceutical ends of these insurance companies are what's keeping the health insurance profitable for the insurance company. And so there's tons of money in there, and they pad them. And obviously this pharmacy is advocating for that. Versus the cash price. There are plenty of other pharmacies out there nationwide that you ask them what's the price for the cash price, and then you ask them what is the price with the insurance, and they will provide that to you and tell you which one's going to be the lesser option, right? Sure, maybe you can't accumulate to your max out of pocket over a $5 drug that you pay cash for instead of using the insurance, but you can make that economic decisions at the pharmacy. You could say, well, I'll just pay the $20 or whatever it is towards my insurance because I need to meet my max out of pocket. Whatever you decide, everybody's different. But I tell you, if you knew there was a cash difference and it was big enough, you might just say, I'm just going to pay cash because it's my money anyways. So, but employers are going to have to get more skin in the game. And part of the Consolidated Appropriations Act, or CAA, it's going to come to light a lot more. It's been there for 3 years now, and more and more employers are going to realize that it's there because they're imposing a fiduciary responsibility for the employer for providing a health plan to their employees as a fringe benefit, and they have to show that they do their due diligence on the health plan to make sure that they're offering the most comprehensive coverage for the most reasonable cost. And just by spreadsheeting plans is no longer enough, and increasing your deductible to lower your premiums is not enough anymore. You actually have to do your work. Now, you could outsource it and you're going to pay for it, and that's fine and respectable. Pay experts to do it. You do your taxes, legal work, HR, all kinds of stuff. You outsource consulting all the time. Why not do it this way? And you should, because you don't have the time to deal with this. But most of the time it's ignored, and it will be ignored going forward. And there's going to be penalties imposed on those employers that decide that they're trusting their current broker for 25 years, so why change? And they're believing their broker, and the broker's not competent or even aware the CAA is even doing this. And that's common. Even locally, there's some brokers that have no idea about this topic other than listening to me talk about it. And there's other brokers that are out there, insurance consultants, that are actually speaking about it a lot more with a megaphone and telling the world then they need to change the way they do their business, because otherwise you're going to get a penalty, and it's not going to be small. It's going to be pretty hefty. At the same time, brokers have a financial incentive to retain the business where it's at. They have most of them on the big level, especially if you're dealing with large shops, have bonuses for retention, right? And the reality is that it forces the broker not to look at alternative options that might be in your favor, and force them to come up with some creative idea about why this is good to stay where you're at, and they get paid and compensated well for it, or at least the agency. And if they're one of their insurance agents that are working for them, or consultants, and they're moving carriers, they're going to get fired. And it's already happening in Chicago. these out-of-box consultants are talking about better options for the employer and not retaining it, and then screwing up their bonuses, and they're moving to another firm, right? Because and they're being forced out. So, and one example is sometimes we could align ourselves with big companies and we can sell services and vendors and insurance products, and we're still the agent, but it kind of aligns ourselves with bigger houses. Sometimes there could be a split of commissions, so we're not doing as much service work. It's like dealing with a distributor, I guess, in some ways, where the distributor actually helps the retail end with whatever they need to make sure they sell products and push product out the door. It's almost the same thing. And so, in a recent conversation, they were bragging about, the first thing they were bragging about was premium reductions. They have so much clout that they could reduce premiums because of their business. But the reality is all of us could do that. We just have to ask for it. And that's my problem with the industry is if you can't give your best price initially, why am I going to sell you? Why do I have to come back and give you a competitive quote so you could reduce it? I just think that, sure, that's competitive markets out there. But I'm telling you, if I'm building a relationship with somebody and I have that kind of relationship that I could call and ask them for a 10% discount or whatever it might be, then why in the world are you giving me the price at 10% higher to begin with? But they were pounding their chest for that, and that's the wiggle room that some of these insurance brokers and consultants have out there. When you get your renewal and say, hey, and they come to you and said, hey, you initially got a 25% increase, but I went back to them and said, you're a good client of mine and we have a good relationship with the vendor or the insurance company, and they knocked off 5 points. So now it's 20% versus 5. Or even if it was lower, it was an 8% increase and we got you down to 6, right? I'm the hero of the day because I did it, right? But it's already built in, right? It's not anything new. It's not anything special. It's just the reason that I think this outfit was sharing that with me is they probably were thinking that I was too small to think that it was even there, and it's there for everybody. The other thing is that they were trying to throw my way is they'd share the bonuses. So I responded and said, so you want me to be unethical to my clients so that the two of us could make more money? And then it was just silence on the phone, and I was like, I'm not interested because I'm not gonna put myself in a situation where I'm incentivized by a bonus, even though I can move an employer to a better spot and they get the bonus of the savings or more efficient health plan or better incentives, whatever it might be on their side, not mine. And so even though we're all in business to make money, like for example, there's an insurance company with a small group market. It's really, really big in Illinois. Hasn't increased their commissions for us. It's a flat rate per member enrolled. They haven't increased it since 2016, right? So we have inflation, we have increased costs, the whole 9 yards. That is completely crazy, and they should increase it for us because we're getting paid the same as we were nearly 10 years ago. And so that's the issue I have with that, and I'm not saying that is unethical. I think we should get paid a reasonable wage for what we do, and that's why I think commissions should be actually eliminated. We just invoice, and employers should be expecting invoices from us just like any other vendor out there. And one day it might be there. It's just going to take some time. A lot of our open enrollments are either underway or closed. The time of this recording is early December of 2023, but when we go into 2024, you can switch plans at any time. So if this strategy that I'm about to share with you that would work in your favor, you can make this move at any time you want, or you can wait until next year and have a runway of making sure you get it done right. This is really for a market under 50 employees because they don't have the employer mandate. You could still do it with 50 plus, but it takes a lot longer strategy. So yes, we need the runway because we need to change things around drastically inside the company in order to make it work. But it could work out to your favor financially and come out ahead. But for 50 and under, there's no employer mandate of providing health insurance. So a lot of those employers may not even offer insurance, or they're struggling to offer insurance, either not paying anything towards the health plan because of the special enrollment period they have from November to December every year that allows an employer to not have any contribution requirements, so which means they're not paying anything towards the plan or even participation. This strategy could basically save the employer money, and if not, it'll be pretty close to what you're paying now, but provide more value to your employees. And so the way we could shift it around, it's got to be the right model, and you have to put it together the right way. You can't just wing it with any broker that's out there. You have to have people with the right set of knowledge with this, right? And this is really, really good for those who are paying their employees minimum wage or a little higher than minimum wage. It's just the nature of the work, whatever it might be. They don't make a whole lot of money to pay for their own health insurance when you're not contributing or paying for it. And so a lot of those will actually qualify for taxpayer subsidies through the Affordable Care Act. And sure, you can go to healthcare.gov and just fill it out yourself, but it's like shooting in the dark. You need some guidance, some expertise behind it. It won't be a government program. It'll actually be a health insurance plan. It'll be a high deductible, but it could be most likely be a zero premium for you or a very low premium. So it's virtually costing you nothing, but the employer still has to have skin in the game to create value for their employees. And so what you're going to do is set up and actually pay for a benefit for your employees, all your employees. It's going to be for everybody. Whether you provide a carve-out management health insurance plan, they get it through their spouse, their higher wage earners, whatever it might be, and then the low wage earners. So you're going to purchase a plan through what they call direct primary care. The direct primary care program allows your employees to go to a local clinic. You're not going to another town necessarily, but it'll be local enough that your employees could actually go there free of charge. It will not cost them to go see a physician on staff or a PA, depending on the outfit that's there and who they're staffing, that they can consult their healthcare needs at no cost. They can go there as much as they want or need to. And it's kind of like quasi-urgent care, but they don't pay anything for it. It's prepay through a membership, so to speak, of the number of employees that are inside of a company. And so the employer's paying for that. Employees could go there free of charge. Sick visits, injuries, whatever it might be. And then a lot of them will actually have pharmacies built in. And so when you prescribe the medication, as long as typically it's a generic or preferred generic, not all brand drugs will be there, and it'll be little or no cost. And so you can provide a program where even though you may have a health plan with a high deductible at zero premium because taxpayers are helping them with the bill, you're providing them access to a doctor they don't even have to pay anything for. And then if they need some basic needs for drugs, they're already covered. Then you're saving money in most cases, not always, but you might be paying the same amount of money because employers need to have skin in the game to make it right, and then provide value to their employees. And if you can't do it through a group health insurance plan, this is another alternative. With that in mind, it leads me to a recent article and publication for our industry in the benefits world that talked about 6 healthcare trends that will shape 2024 group health insurance. And there's a bunch of stuff in here that are probably normal that you would think, like mental health is an issue, preventative care, drug transparency, having access to care. Obviously, they mentioned a little bit about the next presidential election has a huge play in the healthcare. But the one thing I wanted to point out as we wrap up this podcast is employers want more out of their healthcare plans. So they're going to start evaluating and pressing the envelope a little bit on their brokers, the consultants, the insurance companies, their pharmacy benefit managers or PBMs, the digital healthcare vendors that provide technology solutions, right? I don't think they're going to actually go in there and fire them all or put them on check for all their services. But they're going to start going through it, and they're going to start cutting things and firing people because they're going to have more skin in the game. Part of it is going to be due to the Consolidated Appropriations Act. Part of it is just because they're sick and tired of all this, and they want to have more control, and they don't have enough data to make decisions, so they're just going to start holding other people accountable, as we should for our healthcare providers when it comes to billing and claims, as well as insurance companies, and put everything back in a better state.